Auzubillahi minash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Dear fourth year, in this small video, which is based on the questions which I am receiving, I am trying and will be trying to let you know how to attempt the theory and OSPE examination in ophthalmology. Most of the students are in search of MCQs and SAQs, and I want you people to know that when the paper is made, then MCQs pool is present with the university from different professors and different medical colleges, and no one knows that which MCQ is coming in that particular paper. Even the university doesn't know. So better not to run after the MCQs, and at the most what you can do is, if you could find uh, somehow MCQs from the last papers from your seniors or anywhere else, then you can discuss these MCQs with each other or your faculty or with ourselves. You can discuss with me at any forum, and the best way to prepare for the MCQs is to study your ophthalmology book from cover to cover and make a concept of all the diseases and all the stuff which is written in the book. And wherever you feel any difficulty, you may ask any of your colleagues or faculty member. This is the right way to prepare for both the MCQs, SAQs and the OSPE. And another important point is that, which I have been advocating in my previous videos, that in every MCQ and in every SAQ there are a few hints which guide you towards the desired diagnosis, and there are some distractors which may distract you from the right path. You have to pick up those points. For example, in a scenario of primary open angle glaucoma, which I usually quote, it may be written that the only clue can be the patient's everything is alright and the patient only sees occasionally halos around the light. Now, if you have deeply learned the primary open angle glaucoma, this can be a clue for you, but it will be a very difficult scenario. In most of the scenarios in primary open angle glaucoma, any one of the hints like intraocular pressure, optic disc cupping or visual field defect, the triad, any one of them is usually given. So, not to confuse it with angle closure glaucoma. So, when you study, read the differences between the two. As an example, I have quoted you this example. This can be an MCQ or essay, and you have to study from the book. There is no other way, and use your mind very wisely. Read each and every word written in the scenario, because the scenarios are written very meticulously, and if you use the common sense you can pick up the right points. And sometimes, if even you have not read the subject, but on the basis of your knowledge of other diseases, with the help of common sense you may reach to the diagnosis. So don't run after the ready-made MCQs, because they may not be that helpful which you are thinking about. Secondly, same is the case with the SAQs. Don't write long lines. There are only 2 to 3 words which are used in SAQs. Number one word which is used is name the diagnosis or name the drug, anything like that. So you have to write only one thing about against it, because it is of one number. The second word you would be finding will be enlist 3 things about so and so, and if uh, it is 3, then you will get 3 marks, or if the marks are different, they will be mentioned against the stem. These are 2 main words which you will find in your SAQs. Regarding OSPE, at the end of your book, most of the pictures come from your book, and there are 13 stations. Previously there were used to be 11 stations, but now this time there will be 13 stations, out of which 6 will be unobserved and 2 will be types of stations will be observed, and third will be observed or interactive. In unobserved stations you may find the slide of a medicine, disease, and some questions about it, a picture, something like that, and no examiner will be there. In observed stations you will be asked to perform a skill, and an examiner will be looking how you are performing the skill on the patient. He may or may not ask any questions. He has the key and he will mark you according to that key. Third station will be interactive station, where you will be asked to perform any skill, or he may ask you anything which is related or sometimes not related to that particular station. For example, if a patient is sitting with a sixth nerve palsy, he may ask you about sixth nerve palsy, but at the same time he may drag you in other cranial nerves. So not to worry about. In the last, I would like to emphasize, and I want you people to remember it. I have been telling you the whole year that the most important thing is your theory examination. If your theory examination is passed, then you are passed. Then the practical examination or OSPE examination becomes very convenient for you to pass, and For examiners, it becomes almost very difficult to fail you if your theory is passed. And the last point, not the least, never leave the empty paper. Even if you know nothing about any question, write down at least the question number, write down the question itself, and whatever you know, write it down, because there is no negative marking, so at least you will not get the zero. You may get 1 mark just for writing this sort of a couple of lines which may not be related to that question. So these are the tips which I wanted to give you, and these tips are which I have given to you are based on my experience with the students in the examination, in my teaching experience. I hope this video will help you as a in your preparation of ophthalmology examination for 4th year MBBS. And for any questions, please write in the comments box and we can discuss it. And please let me know whatever you want to know about any disease, or if you have got any questions. For now, I will stop here. Hope to see you in some next video. Allah Hafiz.